This is Ed and Pat Sanders saying hello and welcome to African American Health Matters.
Critical numbers of African Americans are dying from prostate, breast, lung, and colon cancer because it's been treated too late. Even more African Americans are affected by diabetes, Alzheimer's disease, hypertension, asthma, high cholesterol, obesity, drugs, and alcohol.
And we are still needing continuing education and more about HIV/AIDS. Our surveys show we need more ways to access resources available in our community and nationally.
There's a staggering number of African Americans who are not aware of drug discoveries that could save their lives through clinical trials. And Ed, we need to educate our people about the importance of clinical trials. African American Health Matters is a mobile health, text message, and multimedia outreach that provides health tips and reminders to subscribers right over their cell phones. And now we have African American Health Matters on Cyberstation USA.
It's health tips for remembering to take your medication and tips on handling everything from diabetes, hypertension, and to tips on losing weight and breaking those bad habits.
You can register online to receive health text messages by going to www.africanamericanhealthmatters.com. That's all one word, www.africanamericanhealthmatters.com. Or you can call our 1-800 number, 1-800-677-8441, and someone will get back with you within 24 hours to get you registered. Many African Americans dismiss the warning signs of Alzheimer's, believing that the symptoms are part of normal aging. Often they are diagnosed too late and miss the opportunity to get the best care possible. This is an even greater concern for African Americans who are more likely to develop Alzheimer's disease than any other population. African Americans have a higher rate of vascular disease. That means diseases involving blood vessels, including heart attack and stroke. And one of the suspected risk factors of Alzheimer's disease are heart attack and stroke. By working together, we hope to reduce the risk factors and reverse the growing trend of Alzheimer's disease among African Americans.
Today we have with us Dr. Maria Carrillo. Dr. Carrillo is the Senior Director, Medical and Scientific Relations at the Alzheimer's Association. At the association, Dr. Carrillo has a wide range of responsibilities, including oversight of the association's granting process and communication of scientific findings within and outside of the organization. Dr. Carrillo received her Ph.D. from Northwestern University's Institute for Neuroscience in 1996.
Welcome, Dr. Carrillo.
And doctor, just tell us what is Alzheimer's disease?
Alzheimer's disease is really a neurodegenerative disorder, which means that it's a disorder of the brain, and that over time it actually continues to damage the brain until it really causes death. And that death is usually related to a deterioration of other parts of the body, unable to really fulfill their activities and keep the person healthy. But essentially, it all really stems from the fact that the brain is undergoing some changes that are really, unfortunately, killing brain cells over time. Unfortunately, there's no cure for this disease, and it is a disease that causes death.
Okay. Now we know a lot of people have their own concepts about Alzheimer's, but what are some of the myths about Alzheimer's disease?
Well, Alzheimer's disease causes very subtle memory changes early on, because it is a disease of cognition, first and foremost, of thinking and of memory. And I think a lot of people, first and foremost, think of this disease as normal aging and don't think to perhaps consult a physician or an expert when they start experiencing some of those changes. I think another common myth that is that perhaps it's something that the person did, or that the person should be ashamed linked to something bad about the person. And that's not really really true either. It is actually a disease.
Mm-hmm.
It actually affects, it's an equal opportunity disease. It affects all cultures, all races, and all countries on the globe. So, these are some of the things that people can be afraid of, I think, when they talk about Alzheimer's. It's very scary to think about a person becoming ill, but with a life-threatening disease. And I think it's even scarier to think about a disease that robs you of your mind when your body looks
Mm-hmm.
like it's really healthy, and it's
Mm-hmm.
your mind that is slowly concerned. We really treasure our independence and our ability to think and our
Mm-hmm.
ability to talk so much more today, and I think that that's a big part of the threat of Alzheimer's.
Yeah, there are a lot of risk factors involved in Alzheimer's, but I think in the African American community where we really, really need that education, and our churches are starting to understand and support it. I think I mentioned to Tony recently that we have programs at the Bishop T.D. Jakes' Potter's House, and the Potter's House has a wonderful program that we would love to be able to work with the Alzheimer's Association in duplicating around the country and other churches, and that is the caretaker time, 4 hours a week, like on a Friday or a Wednesday. The church brings in trained nurses to take care of, and they have a special room set aside with comfortable bedding and things like that to take care of the Alzheimer's patients for 4 hours a week. And I think this is just a fantastic program. We're going to be working with them in May to put on one of our lecture series about Alzheimer's. And I think the important thing, back to where you were talking, is that you see Miss Jones wandering down the street talking to herself, and people tend to kind of point and snicker. And this is something we need to learn. She may be suffering Alzheimer's and may not have a caretaker around to take care of her. Is this logical?
Absolutely. I think many times as we age, some of our older folks may not always have a loved one nearby that
Yes.
can help them, and not only help them, but perhaps even detect some of these earlier signs. Sometimes it's really helpful, for example, to have a church community around you that
Absolutely.
you think about, right, the community members, and actually worry about them or make sure, oh, we didn't see, Mrs. Jones at church,
That's
right?
right.
Right?
That's
So
right.
I think that that's a very important part of community at large. And I think both the African American community and the Hispanic communities have very similar community outreaches like that, and strong family ties that can
Yes.
help. I
Yes.
think the last step that we are missing as communities of color is that really we need more education about what those
Mm-hmm.
small hints might be that
Mm-hmm.
could cause some concern.
Yes.
And if we had a little bit more information about that, I think we could really go so much further because of these tight-knit communities in making sure that our loved ones, our friends and neighbors and families were taken care of. I
Mm-hmm.
think one of the things we point to is that the Alzheimer's Association has launched called Know the 10 Signs. And
Mm-hmm.
it really is a very short 10 list of what that type of things might be of concern. And it gives you concrete examples so that you can say, well, I lost my keys today.
Mm-hmm.
That's not really, a warning sign. A lot of people lose their keys.
Yeah, you're right.
Right, right. I do it all the time.
Or forget what you went to go pick up or something, yeah.
Exactly. If I lost my keys and then found them in my shoebox, that would be a hint that something was not quite right, right? Because I put them away in a place that was not normally a place to put your keys.
Right.
So things like that might actually be helpful to our community, and that information is at alz.org, and it's actually free of charge for anyone to
Yes.
take a look at.
And that's alz.org for our listeners.
Doctor, tell us a little bit about the nature of Alzheimer's disease and the impact on caregivers and families.
Absolutely. Alzheimer's disease is really diagnosis, but can last as long as 20 years.
Mm.
That is a long time for a loved one to care for someone with this disease.
That is.
So that after the first few years, our loved ones already need extra care to make
Absolutely.
sure that they're taking their medications on time when they're supposed to for all of the other things they might have, sometimes diabetes, sometimes high blood pressure, some things like this that are important because if you don't take those medications on time, you actually have severe your health, right?
Yeah.
So we know that that's important. We also know that soon enough, most people, maybe 60-70% of people with Alzheimer's disease, start to experience something called wandering. It
Yes.
get a little bit, or they are unable to recognize where they are, even if they're in their own home, because they don't remember this particular home. That memory is now gone. They perhaps remember an earlier home or a childhood. They want to go to that home, so they leave.
Yeah.
And if it's, for example, I live in Chicago, Illinois. If it's February in Chicago.
Yes, right. We have relatives that way, so we do understand, certainly. Yeah.
Right? And that's just not exactly the best scenario for people. And so they will require longer care. So 24-hour care soon enough in the disease process. And that takes such a huge toll on caregivers. And so what we really try to stress is that communities, like church communities, family communities, end up sharing that burden.
Yes.
There are places to get help. And we have over 70 offices around the country. Those offices offer many times respite care, emergency care, so that the caregiver can actually take care of themselves or get a break. We know, we have evidence that caregivers sometimes really suffer more health complications.
Oh, yes, absolutely.
For the patient, right?
That's
Because they're not taking care of themselves.
That's
That's really some of the things that we worry about with caregiving. Just want to make sure that we care for the carer.
Yes.
That's an important part of really dealing with this disease as a
And it is so. And from a very practical case study point, and my sisters and I have talked about it. My middle sister cared for my father who had Alzheimer's, and it was extremely difficult on her. It was difficult on everyone. And we began reading up about how to share the responsibility because she was there on site and she was taking bedpans and changing and things, and the other sisters are out of pocket. I think one of the things about distributing responsibilities in families with parents or relatives with Alzheimer's is to, and this is what I read, is each person does what they do best. If one person has to empty bedpans, that doesn't mean that everybody empties bedpan. Maybe another person takes care of the financials for the nursing home, and maybe another person does all the grocery shopping, and another person does that. But we as a community, as a village, need to better recognize the small steps that we can do to care for and protect our loved ones with Alzheimer's.
That is very, very true. And caring for the cure is so important because we know that we have statistics that tell us that when caregivers actually let their own health slide, this translates into an $8 billion increase in healthcare costs just for those carers alone.
Wow, those are some numbers.
It's always better to work as a family, as a community, to share that earth for our loved ones. And I'll tell you that sharing does translate into improved healthcare outcomes for our loved ones because we also know that African Americans, even though they're more likely than white to have Alzheimer's and dementia, we know that they're actually less likely to have a diagnosis of the condition. And some of that is that, of course, they may not be visiting their physician as often. They may not be recognizing the signs, certainly, and so education is always a good thing. But the other thing is that many of our elders live in communities that really help them. So they help them cope with the small symptoms that they're experiencing. I mean, I certainly can speak for our own community. The Latino community tends to keep our loved ones with ourselves.
Yes, that's true. That's
we
true.
Cover up all of that because they're our elder. We don't disagree with them. We don't contradict them. We don't correct them.
Yes.
And,
yes.
Right?
Yes.
Them It's
Mm-hmm.
with their life problems. Until they become so overwhelming, we need to seek help. And
That's right.
so I think that it's important to have that diagnosis gap shrink,
I
so that
agree.
it's important for us to recognize that we can keep them at home, but we can also get our elders help, the help.
That's right. Sometimes you think, Dr. Carrillo, that families tend to be a little embarrassed about their loved ones, and that's the reason they don't reach out.
I think that is very much true in our communities. I think in that sense we are very similar. And that is also because of that respect we have for our elders, that, we don't correct them or tell them they're wrong or tell them that they're
Mm-hmm.
losing some of their abilities, their
Mm-hmm.
cognitive abilities, because they are held to such high respect for
Yes.
the life they've lived, their memories, what they know, the stories they can tell.
Oh, yes.
So I
Oh,
think that
yes.
is definitely a part of it. It's also a stigma of again,
Mm-hmm.
losing that part of yourself you hold most sacred, and that is your cognition, your
That's
mind.
right. That's
Um,
really right.
very,
Mm-hmm. That's really true. Question medically, is high blood pressure and diabetes the main risk factors for Alzheimer's or other dementias?
that is a great question. And actually, age is really the biggest risk factor for Alzheimer's disease. And as you know, we are all aging fairly equally and
Mm-hmm.
living longer because of other medical advances today.
Mm-hmm.
But I think after that, really, there's a small genetic component that we can consider that increases your risk, but not everybody inherits that risk. And then after that, we also know that high blood pressure, cardiovascular disease in general, that includes not only high blood pressure, includes right there diabetes, and it includes high cholesterol,
Mm-hmm.
and also being overweight, being obese.
Mm-hmm.
Those things contribute
Okay.
greatly to Alzheimer's disease. They can double or triple your risk of
Yeah.
Alzheimer's.
I think we're reaching back for causes, and it becomes very complex on many levels when we're talking about Alzheimer's, high blood pressure, the salt and the sugars that we start in childhood in our communities with, and that represents love and comfort to us, and those very things that end up cursing us as we get older.
Absolutely.
Yeah.
That those risk factors are actually the things we can point to that we know cause the disproportionate impact of
Mm-hmm.
Alzheimer's disease on the African American community, is that African Americans are actually 2 times more likely to have Alzheimer's dementia than whites because they are more likely to have high blood pressure.
Yeah, that's true.
That's
That's.
something very important because actually having high blood pressure can be either avoided or actually managed, controlled, and perhaps reversed with
Mm-hmm.
exercise and appropriate nutrition.
Yeah,
So
that's
those
true.
things are important to educate our community and saying you're not only protecting yourself now in terms of your cardiac health, you're protecting your mind in the future.
Amen. I will
So,
amen that. That's true.
uh,
That's really
yes,
true.
Doctor, would you say Alzheimer's affects men more so than women or vice versa?
actually, we have a lot of research that points to the fact that women are disproportionately affected
Really?
by Alzheimer's,
Okay.
both in terms of the number of people affected and by the disease diagnosis itself, as well as actually affected as in the number of carers for people with the disease are generally a third more women than men. So
Mm-hmm.
both ways are we affected as women more than men. Now, the science behind why women are affected disproportionately in comparison to men is not clear.
Mm-hmm.
People have been looking at hormones as a possibility,
Mm-hmm.
the changes that women go through
Mm-hmm.
in terms of menopause, but nothing definitive has been found. There have been other studies that look at maybe just longevity.
Mm-hmm.
So at this time, it really is just a longevity issue that we know of it for certain. That women do live longer, and therefore, since age is the biggest risk factor, it tends to be the reason we think today why women are disproportionately affected by Alzheimer's.
Yeah, and that's probably across the board with Caucasian, Hispanic, African American, all the way across,
Asian,
right? Yeah. Okay. Well, we're gonna start wrapping this up, but I did have a final question. And where can families go to find support other than our Alzheimer's Foundation is a part of Association, the Alzheimer's Association is part of our partnership with African American Health Matters, and they are at www.alz.org. But Dr. Carrillo, where can families go to find support and information on resources, local services as they, grapple with the realities of Alzheimer's disease? Where can they go?
There is so much information, first of all, on our website called alz.org about local offices, because we have over 300 points of service across the United States where people can get information firsthand by walking into an office and either talking to someone or picking up information, brochures. So all you have to do is that in that website, put in your zip code.
Okay.
Your closest offices. And if you prefer not to use a computer, the 24-hour helpline at 1-800-272-3900 offers information and counsel from trained professionals, social workers, on the phone 24 hours a day to answer any question.
That's great. Repeat that number one more time, Dr. Carrillo.
That is 800-272-3900. And it offers assistance 24 hours every day of the year in over 150 languages.
That's fantastic.
Where you're calling from or what ethnicity you are, you can speak in your own language and ask questions of a professional. And they could be emergency questions like, I just don't know how to give my loved one a bath.
Yeah.
With Alzheimer's, you do not like to do is shower. Or it could be as simple as, where do I find perhaps an hour or two a daycare respite center I can take my loved one to, like a doctor or myself. So any kind of question is welcome at that 24-hour helpline.
Fantastic.
There are also very important, there's also very important information on clinical trials on alz.org.
Great.
Clinical trials are important because they are the way you can access the most cutting-edge healthcare for a person that has received a diagnosis of Alzheimer's.
Yes, 1,000 times yes.
Yes, they are the place where you might be able to find treatment that is not yet available
That's
to the
right.
general public. So the Alzheimer's Association has something called Trial Match. And Trial Match is almost like a dating service for clinical trials. So in your area, they'll tell you all of the trials that are looking for people like you so that you don't waste your time if you don't match.
Hey, I love that. Now that's on the alz.org site, Trial Match?
Correct. Or by calling the toll-free number. One can get information.
Oh, that is really good. One of the things that we're excited about with our events, our fabulous 50 to Sexy at 60 is what we call them, is that it is a combination of education about the disease as well as education about African Americans and Hispanics, of course, participating in clinical trials. We are not guinea pigs. As you say, sometimes we're tested on some of the most cutting-edge drugs that are not even on the market yet. And so we cannot emphasize that enough, Dr. Carrillo. Thank you so much for bringing that point across.
Absolutely. It's so important for our communities to be represented and have access to that extra assistance.
That's right.
Because other people do it, they know that it improves their healthcare and their healthcare outcomes, and we need to take advantage of those things as well. So the Alzheimer's Association launched Trial Match specifically to be able to help people and make it easy for them to find a trial near them. So please, absolutely encourage everyone to know about this effort and how important it is to actually utilize these resources.
Absolutely. This is great. Well, this has been a wonderful, almost half hour now, and just perfectly. The last thing is, do you have any other points we might bring up with regard to, as closing thoughts regarding to Alzheimer's as we discover it, as we live with it, and as we manage it in our families?
I think the last thing I would leave people with is that it's important for all of our audiences and communities to know that the Alzheimer's Association is working very closely with the federal government to try to actually call to their attention the importance of the epidemic we are living in today and the lack of resources, education, physician education, and actually enough clinical trials and medications to really affect this
signed it away. Yes, indeed.
We did in January of last year, and we're excited that this year we've actually already got a resurgence of about $150 million for the next year and a half for Alzheimer's research specifically, and maybe even as the national plan it becomes organized, hopefully as the federal government has decided we will combat this disease by 2025.
Yes.
We'll be pointing to more resources for Alzheimer's research, education, and care over the next few years.
Yay! Wonderful, wonderful.
Dr. Carrillo, we thank you so much for being a part of African American Health Matters.
Yes, we do.
And we certainly appreciate your time, and we look forward to speaking with you in the very near future.
Thank you so much for having me. It's just been a pleasure, and I'm so excited to be able to work with any of our communities to disseminate this important information. I think we just really need a little bit more education for our communities because we are affected by this disease disproportionately, and we need to get that health care that's out there because it is there for us. We just need to go out and get it.
And we're here on Cyberstation USA.
Snoring affects many people during their sleep. Often people do not even realize they are snoring. Let's turn on the lights and see where the snoring is coming from. Snoring occurs when the airway becomes partially blocked, forcing the lungs to inhale harder to compensate for the lack of air entering the body. The snoring sound results from the vibration of these two structures, the soft palate and the uvula. Several factors contribute to snoring, including excessive alcohol intake, nasal congestion, obesity, and enlarged tonsils and adenoids. Snoring by itself is not necessarily dangerous, but some snorers have such severe airflow blockage that it prevents them from getting quality sleep. This condition, called sleep apnea, is common but dangerous if left untreated.
Be sure to tune in on Fridays from noon to 1 to African American Health Matters on Cyberstation USA.